Good morning, everyone. My name is Eileen Nolan. Thank you all so much for being here. And anyone who knows me well probably knows that I'm a huge fan of Grey's Anatomy. So when I was working on developing my Keystone project, I wanted to look at mental illness through the lens of medical dramas and kind of see how different conditions were being portrayed on TV. So I'm very excited to share my project with you and also my results. So most of us were probably told at some point that we shouldn't believe everything that we see on TV. And while that's really great advice, there's a lot of evidence suggesting that a lot of viewers might not necessarily be taking it to heart. There's definitely this idea that people kind of see what they see on TV informs their perceptions of the real world, even if those images aren't necessarily true. And that can be really concerning, especially when it comes to images and information that are related to our health. So medical drama series are seen by the public as a reputable source of health-related information, even though there's a lot of research suggesting that they do have a lot of inaccuracies and kind of promote some misperceptions that could be taken in by viewers. And when it comes to mental illness has typically been portrayed in TV and film in a negative, kind of derogatory light, and it also has pretty strong associations with violence. So if people believe what they see on medical drama series and these TV depictions of mental illness are also generally negative, I kind of wanted to know if medical dramas could be misrepresenting mental illness and also if they could be contributing to stigma among viewers towards mental illness. And this kind of became the guiding question of my Keystone project. So I decided that I wanted to focus more specifically on the portrayal of schizophrenia on shows like Grey's Anatomy and Private Practice. I wanted to see more specifically how accurately schizophrenia and its symptoms were being represented on TV. And that kind of just comes from a place of curiosity about whether or not viewers are misinformed, first of all, about what exactly schizophrenia is. And one way that I was able to kind of assess this was using this giant book right here. It has a very long name, which is on the cover, but we just call it the DSM-5 in psychology. It's basically a list of all of the diagnostic codes for different mental disorders that psychiatrists will use when they're diagnosing a patient. So it has all of the criteria right there. It was very easy for me to kind of adapt into my analysis. And then the second part of my project, I wanted to explore a little bit more deeply the subliminal messaging around schizophrenia and kind of what messages were being communicated through these medical drama series. So before I go any further with the project, I just want to make sure that everyone has a clear understanding of what exactly schizophrenia is. It's classified as a psychotic disorder in the DSM-5, and it has these 5 key symptoms, which are the main criteria that I kind of adapted from the DSM to use for my project. And all these symptoms are part of this wider condition known as psychosis. There are a couple things that I want you to notice. First of all, there's one thing that we don't see up here, and that is split personality. So split personality is something that a lot of people think is associated with schizophrenia, but that's actually not true at all. So that kind of indicates that it is a really big misconception, and it also kind of highlights why it's important for us to look at how these diseases are being represented on TV. I also want you to focus on the 2 dark purple boxes over on the left. Delusions and hallucinations are pretty pronounced and even kind of startling symptoms. And for that reason, I thought that they might be manipulated for dramatic effect on these TV series and kind of used to up the entertainment factor of these shows. So to collect my sample, I watched all of the episodes of Grey's Anatomy, Private Practice, The Night Shift, and Chicago Med through the most recent season, which is spring 2018. So I did a lot of TV watching over the summer. And I identified all of the cases within these shows that had either a diagnosis or a differential diagnosis of schizophrenia. Once I had that sample, while I was viewing, I was able to record some indicators about the different symptoms, treatments, and stereotypes that were embedded within these episodes. And once I had all of these cases, I did a simple frequency analysis just to kind of see which of these indicators were most prevalent, kind of get a general picture of what was being portrayed on these shows from a statistical perspective. And I also wanted to supplement that with a little bit of a richer idea of the messaging. So I did some qualitative coding of the transcripts and also the episodes as I watched them to identify some major themes within these cases. So I want to start off with some numbers. If you look at this table that I have here, we can see in this purple circle that roughly 85% of the cases I identified did meet the diagnostic criteria for schizophrenia. And that's actually a pretty positive result. It means that the medical consultants on these shows are doing a pretty good job of giving viewers an accurate picture of what schizophrenia is. And they're not really likely to develop a misconception about the key symptoms or the clinical management of the disorder from the images that they're getting from medical series. And while we're talking a little bit about diagnosis, I also wanted to point out a little bit of a surprising finding, for me anyway, and that was that roughly half of the cases I identified were misdiagnoses. So basically the patient was taken in. Usually they only had one of the key symptoms, and that kind of served as a funnel for the physicians to give them that diagnosis or differential diagnosis of schizophrenia, even if later it was found to not be true. So a lot of these characters had psychotic symptoms that were later explained by another condition or another psychiatric disorder. And one possible explanation for this is that schizophrenia might actually be being used for a dramatic effect. So if you remember earlier, I mentioned those distinctive symptoms. And if we look here at the top of the table, we can see that the majority of the characters that I identified are exhibiting delusions, hallucinations, or both. So these are pretty prevalent on these shows, and that kind of suggests that the symptoms of schizophrenia might be being used to provide a good storyline or entertainment to viewers, even though these portrayals could be overdramatic and kind of misrepresenting, first of all, what these symptoms are like, but also how prevalent they are within this population. To give a look a little bit more at the qualitative side, one of the main themes that I identified was just that most of these shows were taking a very clinical approach to schizophrenia. And this isn't really a surprising finding. They are medical drama series. You would expect kind of a hospital-based approach. But this medical setting was used to kind of explicitly combat the ideas of stigma that surround this disorder. And schizophrenia was generally portrayed as a treatable disorder. So if we look at some of the quotes here, the dialogue, I think especially at the bottom, is kind of explicitly denouncing some negative preconceptions that these shows, I guess, might think that their viewers have about schizophrenia. So just taking this approach from a clinical and patient care setting kind of means that these shows are taking this perspective where they want to show it as a neurobiological disorder, and that it's also a treatable disease. A little bit on the less positive side, I also found that roughly half of the characters on these shows were associated with some form of violence. Now, this was usually more non-severe forms of violence rather than really graphic or explicit portrayals. So that usually included something like pushing or grabbing or throwing things, usually as a response to a delusion or hallucination, and not the more severe things like homicide or explicit representations of criminality. So while there is definitely a link between schizophrenia and violence on these series, it did trend a little bit more towards implicit portrayals, and that kind of suggests that these shows might have some self-awareness about the messages that they're communicating and how they could be interpreted by their viewers. That being said, they do still cultivate this idea that these patients are somewhat unpredictable and risky, and that was usually through portraying them as a threat either to doctors or to themselves. So that's very evident in the picture on the left over here. And we see that this potential for violence was used to rationalize inpatient psychiatric care, usually by physicians. So a lot of the patients and family members actually resisted these suggestions. They kind of saw institutionalization as a loss of hope or a last resort. So these shows weren't really promoting the idea that everyone with schizophrenia should be institutionalized, but they definitely were talking about it through the different portrayals. Also kind of adding to this more negative side, there was another theme that schizophrenia was generally portrayed as a burden for both patients and their family members. And this was communicated in a couple of different ways. So if we look at the top, we can see that a lot of physicians were using this kind of victimizing or apologetic language when they were delivering a diagnosis of schizophrenia. They almost delivered it as if it was a terminal illness, so it kind of just highlights the chronic nature of the disorder and how it is kind of being portrayed in a little bit of a negative light. There's also an emphasis on all of the negative effects for caregivers. So if we look at the bottom quote, this is from a mother of a patient, and she is describing how taking care of her son who has schizophrenia has basically become her full-time job. So this highlights the chronic nature of the disease and how a lot of these individuals do require lifelong support. And then the last thing that I want to touch upon is just the use of language within the sample. So similar to that apologetic diagnosis that I was talking about in the last slide, a lot of these patients were described with terms like being lost or slipping away from people. Basically that their true selves were hidden underneath their symptoms. And this kind of just emphasized that they were generally seen as disconnected from reality and different from their quote-unquote normal selves. So that had a little bit of a negative connotation as well. And then finally, I have one last data table for you. Overall, we saw that the negative terms, so things like crazy, freak, nuts, words like that used to describe these individuals with schizophrenia were found more frequently than sensitive terms like mental illness or psychiatric disorder. When I did a case-by-case analysis, so just looking at how often positive and negative words were seen in each case, it was a little bit more of an equal distribution. But it's still kind of surprising to me that stigmatizing terms are still being used in these shows, especially given the previous findings that it does seem like they're trying to promote a little bit more of a positive image, and these could potentially counteract those more positive clinical images that we saw a bit earlier. So just to wrap up, how much should we actually believe about what we see on TV? From a clinical perspective, at least, these shows are fairly accurate in their representations, but it is a little bit more difficult to assess the effects of social portrayals and the implicit themes that I described. So it does seem like these shows are trying to take a sensitive approach, but these efforts might be offset by the more implicit negative images, so especially messaging around violence and then the language that I mentioned earlier. And that is a very fine line for these, I guess, producers or directors to walk, especially if we look at something like violence. We obviously don't want to be promoting the idea that everyone with schizophrenia is dangerous or violent, but we also kind of have to balance that with statistics that do show that there is an elevated rate of violence within this population. So ultimately, we need more experimental research to kind of develop a causative relationship between series and then viewer perceptions and really understand exactly how these shows are influencing people's ideas and potentially the development of stigma. But this does serve as a really good starting point for just understanding how other mental illnesses are being portrayed on medical drama series. So before I take any questions, I just have a few acknowledgements. I want to recognize my amazing advisor, Dr. Margaret Ross, as well as Dr. Christina Persad, who gave me a lot of good feedback, Dr. Greg Harbaugh for looking over my statistics, and then all the directors, faculty, and staff at the Kilshawn Honors College for their continued academic and financial support. And now if anyone has questions, yeah.
Were there a lot of, the characters that you looked at, were they primarily like case of the week patient characters, or were there any like recurring characters or main characters in the show? And like, how do you think that affected the portrayal, or did it affect the portrayal?
Mm-hmm. Yeah, so I did look at like who the character was essentially. Most of them were patients, which kind of just reflects the idea that they were being used as like transient characters on these shows. So I think that there were a couple of instances where they had a recurring character. There was one instance of a main character, and I think that was probably the most telling because it was really embedded in the storyline, and like everyone else on the show was kind of focused on this one character and their symptoms, and it really did come through as like a very negative thing, specifically for this character who the audience would be attached to. And that was also a case where it ended up being a misdiagnosis. So I guess you could kind of interpret that as like, okay, audiences are very attached to this character. They don't really want to see them meet like a quote unquote negative end or fate. So it looks like they have this issue, but then ultimately I think they ended up having a brain tumor. So there was definitely a difference between the patients and the recurring characters. I think the patients a lot more, it was kind of just like on a case by case basis, they would just take them in and then kind of assess them as part of the storyline. Yeah.
So something like Grey's Anatomy, I'm an avid follower, but it's a long show. It started in 2005. So over all of these years, do you feel like the portrayal of this changed over time and like over the different research and years?
Yeah, that's a really great question. Something that I've actually identified for future research is kind of, since we're moving into this kind of like cultural moment of really being accepting of mental illness, how it has changed over a really long series. There weren't a ton of portrayals on Grey's Anatomy. I want to say there were 4, but I definitely noticed that on the later end of the show, there were more of those explicit statements that were trying to combat stigma. So there was one episode 2 or 3 seasons ago where they had a schizophrenic patient, and there was a lot of dialogue around how this is treatable. Let's talk about the prognosis and talk about the different medications that are available. Definitely trying to cultivate a more empathetic image. So I can't really say for sure, but I would say trending that way, yeah. In the back.
Great presentation, really interesting. Do you take into consideration genre and kind of the structure of the serial melodrama aspect of these shows? Because some of the things you highlighted, like the misdiagnosis, is very clearly part of the kind of the melodrama episode structure.
Definitely.
So that the lead doctor can then learn and grow and kind of evolve by the end of the episode. And same with the violence is something a lot of patients kind of in a variety of diagnoses face against the doctors. So did that kind of influence at all?
So when I was mentioning kind of how I was wondering if it was being used for dramatic effect, those were sort of the things I was thinking about. As far as a deeper analysis, I I'm not a communication student, so I don't really have like the knowledge to do a deeper analysis of that. But I definitely agree that it's something where I think a lot of the imagery is more implicit and kind of through those storylines. Like that's where you're going to get these more like undertones kind of communicated. I can take one more question. Ethan.
The table of negative language that was used, was that from health professionals or anyone in the show?
That was from anyone in the show. Initially, I was going to break it down by health professionals, but it was kind of more work than it was worth, really. But there actually was like a significant proportion being used by health professionals, which was obviously pretty concerning. That not only were they still using these terms, but they were also kind of being shown by the people who were supposed to be the most empathetic. Yeah, thank you.